A new variant of the MPOX virus known as 1B has been seen to be a lot more transmissible than the 2022 clade, which was previously only seen to be spread via close intimate sexual contact. Now the latest variant has been spreading through non-sexual means and is now affecting the entire body with blisters compared to just the mouth and genitals previously. Cases have been spotted outside of Africa during the past week, including one in Sweden and another in Pakistan, while several African countries that never had a case are now reporting infections. Health Minister Terence Dialsingh says Trinidad and Tobago has already taken proactive steps to ensure protocols are in place in the event of a suspected case.
You are not screening or testing for MPOX at the airport. That is not done. You are testing for fevers, which could be due to anything. However, we are also working with CARFA through Caribbean Impacts to get the advanced passenger manifest, which tells us who has been to Africa.
If a passenger presents a fever and has recently been to Africa, the minister said there are protocols for quarantine and isolation, such as what previously existed during the pandemic.
Because this one seems to be spreading more easily, we have our isolation facilities in the public health sector. For example, CORA, where we have negative pressure rooms and so on. So we can isolate persons if we need to isolate.
And with the severity of the new clade currently between 3 and 5%, Minister Dialsingh said there's no need to vaccinate the population at this time.
What is recommended for us is one, advising people if you are going to go to Africa to be careful. Two, if we vaccinate the general population, there is currently limited production capacity. Therefore, our vaccines will finish. And then if we have a case, I will have no vaccines.
He said Trinidad and Tobago does have vaccines for at least 1,400 people at this time if the need arises.
We in Trinidad imported in 2022 2,800 doses of Bavarian Nordic vaccines. It's a 2-dose regime, so therefore 2,800 doses means you can vaccinate 1,400 persons. The cost of those vaccines in 2022 was 238,000 euros or 85 euros per dose.
Minister Dialsingh, though, is urging the international community to ensure a situation doesn't present itself similar to COVID-19 and is encouraging countries to share vaccines with Africa where the virus is raging. And as for if citizens should be concerned,
COVID taught us that public health issues need to be taken seriously, and we should be concerned about close contacts with anyone who has been to the African continent, where the virus is really raging at this point in time.
If there is a suspected case, CARFA will conduct PCR testing with a turnaround time of 48 to 72 hours. Minister Dialsingh said the vaccines currently in stock will expire in September 2025. Sonolala, TTT News.